one of the topics like we got connected on was one time I was talking about UTIs and tight clothing and whatnot. I think for me, the older I got, and I don't know if men also you experience this, it would be great for a men's perspective. When you get older, clothing, does it become a health factor you really have to consider? For me, after having children, I find there are certain places that you just can't tighten, like, or else you're restricting. I pay attention more to blood flow, and after you have a baby, you do feel all those portals opening for the milk and whatnot. So like clothing is important. So I don't know how it changes for men. You men, nothing changes other than you drink beer and then okay, that's all. But like realistically, are there like if you can discuss about like tight clothing, the pros, the cons, how we all have to maybe take it into consideration or not as males and females, and I'd like your opinion as well from a male perspective.
I think so. I come from a very conservative, old school background. Like when you're so I'm speaking from that perspective. When you're younger, you want move the fashion trends. You want to put the tight shirts on, even when you don't have abs and muscles. But I think the older you grow, you want to have something that's functional. You have a shirt that's not so tight, but just fits enough. You have pants that fit just right enough. I think for me, the older you grow, you just want something that's functional. Instead of putting on a tight shirt, I'll be like, okay, yeah. It's not something I would put on and go out there. No, everything has to be functional. And yes, some people do mind about the fashion and whatever, what kind of designer is this, but me, it's just a function. The older you grow, I realized everything just has to be functional, and that's good enough for me. Something that's not tight, the shirt that just fits right enough, the pants are just right, the shoes are just right. Everything else has to be functional.
From the medical point of view, the reason women are actually more predisposed to UTIs than men, and the reason that is because the tube that carries urine from the bladder outside for women is shorter than it is for men. So if you think about that from an anatomical point of view, bacteria usually crawl from the outside inside. So if the bacteria have a long way to go, it's going to be harder to get in and cause a problem. So for women, the tube is short, and then things like pregnancy. When women are pregnant, the anatomy changes. The tube might be a little bit shorter, so things can crawl in from the outside in. And then
so tight underwear is what you're talking about.
It's not tight underwear. It's just like, forget the whole even before the clothing, because I'm going to address the clothing next. So for women, if the tube is this long in between your bladder and the outside, that's one thing. For men, if it's like not, I'll just keep it generic, but I mean it's like this long, then it's like these bacteria are small. It's going to take a while. So by the time they're ready to crawl halfway up, they're dead. But for women, they're like, they can get there and cause a problem. So beyond the clothes, first of all, for women, it's an anatomical thing. And then when women are pregnant, everything stretches and opens. It's just the way it is. So the bacteria have like a much easier path to get inside. So it's first of all anatomical. And then some women, on top of that, the tube is short. The angle should be this way, so it's harder for the bacteria to go up this way. Some women anatomically have an angle that's changed, so it's easier for the bacteria to go in. So before clothes, women have those things that predispose them, but not all women are going to get a urinary tract infection if they're wearing tight clothes. If you're pregnant and you're wearing tighter clothes, okay, that might be a problem. So in general, we do not advise our patients to avoid tight clothes just because that's going to predispose them to a UTI. And we do not necessarily say, if you're wearing a wet bathing suit, you have to change it quickly. In general, the way that anatomy is to begin with, it should be fine. But then pregnancy, also immunosuppression. Say if somebody's on medicine for an autoimmune condition, then not only the regular bacteria that cause, or the bacteria that cause problems, plus the regular bacteria that don't cause problems, they're going to crawl in. If somebody's diabetic, their immune system won't fight. So even if they have the right angle, even if the tube is longer, we have men who have who are immunosuppressed just because of age or say diabetes, they're more predisposed to having a bladder infection than a man that does not have, a low immune system. So I wouldn't be as bold as to say people have to restrict or change their clothing just to avoid a urinary tract infection. But if you're a pregnant woman, you're having symptoms like abdominal pain when you urinate, you need to get that treated, because women who are pregnant with a bladder infection are more likely to have premature labor. So there's a reason for that. But no, it's not that tight clothing causes it. It's more the anatomical issues.
So it's sometimes the comments on there. The modesty topic is being taken so out of context, and it's more about a person than it is
Yeah.
about fabric. It's about health, mentally, physically, emotionally. So I guess we've touched on the topic about tight clothing, tight underwears, or UTI. So